Hi everyone, I'm Nell Smircina, a licensed acupuncturist in the state of California and diplomat of Oriental Medicine. I'm here to talk to you today about what acupuncture can do for you. A lot of people aren't experienced with acupuncture, they have so many questions, and I'd like to talk to you about that. So what is acupuncture? How does it work? What conditions can actually be treated? What should I expect the first time I have acupuncture? Does it hurt? How do these needles actually help me? These are just some of the many questions I get about acupuncture, and I'd like to answer some of them for you today. Now, at this amazing integrative center, we work together developing treatment plans that are customized for each individual. Everyone's bodies are different, and everyone's needs are different. So how does acupuncture fit into all this? Does it really work? Well, I'll start by telling you my story. I was a gymnast for 12 years and tore my rotator cuff. I began developing all of these issues after that happened and got to the point where I had constant trigger points or muscle knots in my upper back that would radiate pain to other areas of my body. I was working in a physical therapy office at the time, treating my own patients, and I'd have these issues with numbness, tingling in my hands. I'd drop things because my grip strength would give out. I started getting lidocaine injections in my back and neck every 2 weeks just to feel like I could do my job. So I'm sure this story sounds similar to a lot of you, or at least familiar in some way or something you can relate to. I went from being a gymnast and soccer player, a constantly active person, to someone who was relying on doctor's visits and injections of medication to get through my workday. And I was 22 years old. So there was an acupuncturist at the wellness center I was working at, treating many of the same patients that I was. So I decided, I'll give it a try after hearing so much positive feedback from my patients about their own experiences with acupuncture. So what happened was really interesting. I definitely noticed an immediate difference in pain. I noticed I had to get injections less, and eventually didn't have to get them at all anymore. But other things improved too. My energy was better, my sleeping was better, and my headaches I was constantly having stopped. Things I hadn't even really considered to be big issues in my life were noticeably better, and I was stunned at this amazing modality. So the more I experienced, the more I wanted to learn, and eventually ended up going back to school to learn this medicine as a profession. So I wanted to be able to address completely and holistically the issues my patients were experiencing. I love the human body, and I'm particularly aware of how to treat issues with pain, but along the road I've been exposed to the many things that acupuncture can treat, and I'm so excited to offer that experience for you. So what should you expect at your first treatment? Well, at a first appointment, we go over your medical history and what you want to work on. I'll ask you questions about your lifestyle. I'll do an exam, which should be individualized for you based on what you're experiencing. What makes acupuncture so effective is we really get to the root of what's going on with you as an individual. Everyone's body is different, everyone's needs are a little different, and so is the treatment plan. It's not one size fits all. So as part of my exam, I'll take your pulse and I'll look at your tongue. Okay, I know that sounds kind of weird, right? Well, the thing is, when acupuncture was developed thousands of years ago, there weren't MRIs, there weren't x-rays, there weren't CT scans, and no lab work to look at. Practitioners had to rely on what they could see and feel in order to diagnose. The tongue is the only visible muscle in the body, and it gives us a look at what's going on inside. I still do blood pressure, I still ask you about medications, I'll request your medical records and your lab work because these tools are now available to us. I'll still do many of the things that other doctors do, but we'll look a little bit deeper in a different way to help figure out what's going on and how to best help you optimize your health. So after we go through all that, the needling will start. Now, let's take a look at these needles because that seems to be a bit of a hang up for some people. All right. Okay. So see how tiny these are? You can fit a bunch of these in the head of a syringe. So no, you won't feel the pain of an injection. You may experience a heaviness, some tingling, or nothing at all. It's not painful, but more so just a different sensation than you're accustomed to feeling. It's all normal. We'll talk through it every step of the way, and you will actually get comfortable with needles. I have patients who come in all nervous and end up falling asleep during the treatment because they get so relaxed. Acupuncture affects many of the body's systems. It's been shown to improve circulation, decrease inflammation, and help with pain. Your nervous system, endocrine system, and circulatory systems are very important in these goals, and acupuncture can affect them naturally. So if you're having issues with pain, fatigue, stress, autoimmune conditions, if you're prepping for surgery or recovering from an injury or a surgical procedure, or even if you're looking to make some improvements cosmetically, acupuncture may be able to help. I'm always happy to answer a question or do a consult and let you know how acupuncture can benefit you. So thank you all for listening today. I love talking to you about acupuncture. We're here at Sonari Sanctuary, Beverly Hills Headache Institute, and we're all here to help you optimize your health. Thanks.